This video is going to be mainly about liver function. It's still part of the health assessment for the PMHNP resource manual review, so the Purple Book review, and definitely added notes from my own research and notes throughout the program, throughout my school program. Liver function tests are used to monitor liver disease or damage caused by hepatotoxic drugs, as confirmed by elevated levels. Liver function tests can help determine an area of the liver where damage may be taking place, and depending on the pattern of elevation can help organize a differential diagnosis. Elevations in ALT and AST disproportionate to elevations in alkaline phosphate and bilirubin denote hepatocellular disease. An elevation in alkaline phosphate and bilirubin in disproportion to ALT and AST would characterize a cholestatic pattern. The actual function of the liver can be graded based on its ability to produce albumin as well as vitamin K depending clotting factors. Liver function tests, also referred to as a hepatic or liver panel, are the following: ALT, AST, ALP, GGT, PT, INR, albumin, total protein, and bilirubin. The liver also plays a significant role in metabolism, regulation of red blood cells, and glucose synthesis and storage. The lab value ranges are listed here. I left the typical ranges right after the test, and then with a dotted line, I've adjusted what I'm going to try to remember regarding the results. So for the ALT, I'm going to remember that it's 4 to 40, and same for the AST. For both of those values, I'm going to remember 4 to 40, and I'll be watchful and acknowledge that we have an elevated level of AST or ALT if we're looking at values greater than 40. Alkaline phosphate, 30 to 120 seemed easy enough to remember. Alkaline phosphate, 30 to 120. The GGT at 5 to 50, and I'll remember that albumin is 30 to 50. And that is what I'm going to commit to memory. In patients with alcohol use disorder, AST to ALT ratio is generally at least 2 to 1, showing a high level of AST activity in alcoholic liver disease. An elevated GGT along with AST also suggests alcohol abuse. GGT should not be used alone since it is not very specific for alcohol. Alanine aminotransferase, or ALT, normal values are going to be 4 to 40. Formerly known as glutamic pyruvic transminase, or SGPT. ALT is an enzyme produced by the liver that acts as a catalyst in the transamination reaction necessary for amino acid production. ALT is found in liver cells in high concentrations and in moderate amounts in body fluids, heart, kidneys, and skeletal muscles. When liver damage occurs, serum levels of ALT rise to as much as 50 times the normal value. So 50 times the normal value, which is 5 to 35 or 4 to 40. Pronounced elevations of ALT greater than 300 are equivalent to liver disease or damage such as hepatic cancer, hepatitis, or infectious mononucleosis. Moderately elevated ALT at values of 100 to 300 can indicate biliary tract obstruction, CHF, MI, muscle injury from IM injections, trauma, infections, seizures, and acute pancreatitis. This is not an exhaustive list. There's more diseases listed or conditions listed in the book, but this is what I'm going to commit to memory. Some interfering factors with ALT values are uremia and hemodialysis cause a false elevation in the level of ALT. Medications that can increase ALT levels are many, but I'm going to zoom in on these 4: acetaminophen, aspirin, carbamazepine, and phenothiazines. Others listed are cephalosporins, codeine, digitalis, or contraceptives, and more, including propranolol, tetracycline, verapamil, indomethacin, codeine, and cephalosporins I mentioned. Next, we're going to talk about AST, aspartate aminotransferase. The value I'm going to remember is 4 to 40. Aspartate aminotransferase, AST, the normal values are 4 to 40, previously known as serum glutamate oxalate transminase, or SGOT. So the ALT used to be known as the SGPT, and the AST used to be known as the SGOT. AST measures the level of the enzyme that catalyzes the reversible transfer of an amino group between the amino acid aspartate and alpha-ketoglutamic acid. AST exists in large amounts in both liver and myocardial cells, and in smaller but significant amounts in skeletal muscles, kidneys, the pancreas, and the brain. Serum AST rises when there is cellular damage to the tissues in which the enzyme is found. Pronounced elevations in AST greater than 5 times the normal values are caused by acute hepatocellular damage, myocardial infarction, shock, acute pancreatitis, and infectious mononucleosis. Moderate elevations of AST at 4 times the normal values can be caused by biliary tract obstruction, cardiac arrhythmia, CHF, liver tumors, chronic hepatitis, and muscular dystrophy. This is not an exhaustive list, but this is what I'm going to commit to memory. Slight elevations of AST, or 3 times the normal values, can be caused by pericarditis, cirrhosis, fatty liver, pulmonary infarction, delirium tremens, CVA, or hemolytic anemia. Interfering factors, or factors that increase AST, there are multiple drugs. The ones that I'm going to remember are cholinergic agents, oral contraceptives, antihypertensive agents. Also, exercise can cause increased levels. Gamma-glutamyl transpeptidase, or GGT, the normal values are 10 to 38, but I'm going to remember 10 to 40. GGT is an isoenzyme of alkaline phosphatase and assists in the transfer of amino acids and peptides across cellular membranes. Hepatobiliary tissues and renal, tubular, and pancreatic epithelium contain large amounts of GGT. Other sources of GGT include prostate gland, brain, and heart. GGT is used to evaluate and monitor a client with known or suspected alcohol abuse because levels rise even after ingestion of small amounts of alcohol. Also used to evaluate elevated alkaline phosphatase of uncertain etiology. Pronounced early increases in GGT are found in hepatic disease. Modest elevations in GGT occur in cirrhosis and in pancreatic or renal disease. Interfering factors. Increase in GGT can be caused by alcohol, barbiturates, and phenytoin. A decrease in GGT may be caused by late pregnancy and oral contraceptives. This concludes the liver assessment. The following video, part 4, will cover the rest of the chapter topics on chapter 6 about the health assessment, prevention, different populations, and guidelines.